Also on What's Brewing, Narayana Health, one of India's leading hospital systems, W Health Ventures, a healthcare venture capital firm, and 2070 Health, a healthcare-focused venture studio, have come together and launched Everhope Oncology, a chain of medical and surgical oncology facilities. Everhope has secured $10 million in seed funding to establish medical and surgical cancer care facilities in Delhi and Mumbai and plans to expand to 10 cities over the next 3 years. To elaborate more, joining me now are Viren Shetty, the Vice Chairman at Narayana Health, and Dr. Pankaj Jethwani, Managing Partner and at W Health Ventures. Gentlemen, welcome to Startup Street. Viren, let me start with you. What inspired Narayana Health to partner with W Health Ventures and 2070 Health to launch Everhope Oncology? Also, if you could take us through your model and the venture's offerings.
Sure. The genesis of this came in a conversation that I had with Pankaj when I told him that we're facing a major problem in that we are building such large hospitals, we're investing in all the highest and latest end technology, getting very expensive doctors who've trained at some of the top medical colleges all over the world and buying surgical robots. And yet people don't want to come to the hospital. They don't want to come and they don't want to get treated in a hospital-like environment. And then we realized that people want to be treated much closer to their home. They want to be treated in a retail setting. So I said, what can we do? As a hospital group, we have to not think about building things in hospitals. How do we go about it? And that was the genesis of the idea behind setting up this venture.
All right. Moving on to Dr. Pankaj now. Cancer care in India faces major challenges, like Viren also pointed out, from late detection to overburdening oncologists. How does Everhope Oncology plan to address these pressing issues? What are the offerings?
Yeah, look, I think the reality we're living today is that 150 million Indians who are alive today will have cancer at some point in their lives. And as a health system or as a society, we are not prepared. Patients with cancer not only go through their journeys of the clinical complex journeys that they also have to face a lot of uncertainty, anxiety, chaos, lack of clarity, and it doesn't have to be this way. With Everhope, we're trying to redesign what we know of cancer care today. We want to bring high quality cancer care, but bring it in an extremely patient-centric format, closer to the patient's homes. And as a platform, we will continue to work on early diagnosis, daycare, chemotherapy that is closer to patients' homes, as well as other modalities, including surgical care. You mentioned doctor shortage. There's a huge supply constraint in this equation. We don't have enough oncologists. And our desire at Everhope, right from the get-go, is we're actively looking, literally trying to hunt down highly entrepreneurial, like-minded oncologists who are interested in redesigning cancer care along with us and are interested in becoming business owners, right? So that's the mandate and thesis.
All right. Going back to Viren. Viren, affordability remains a huge barrier to cancer treatment in India. And, while you're starting with facilities in Delhi and Mumbai, plans are to expand to 10 cities in the next 3 years. How does Everhope Oncology plan to make advanced treatments more affordable to a wider population?
See, the largest components of cancer treatment are in the medicine cost. And the government has done a good job in trying to bring a lot more local sourcing in enabling companies to get the APIs done in India. So medicine costs are quite affordable. And with new medicines being added to DPCO, a lot of patients won't bear the burden of very high costs. And as it is in India, for the quality of care you get one of the lowest prices in the world. What we're trying to solve for is healthcare access. Not so much about whether I can afford oncology or not, but the biggest barrier most people face is taking their aunt, their nephew, their grandmother, their cousin, their neighbor to a hospital to get checked up. So we're hoping that by building much smaller facilities in much more convenient locations, closer to where people work or where they live, that stigma gets removed from accessing the first level of cancer care.
Okay. Dr. Pankaj, coming to you now, you've previously mentioned that global innovations like CAR-T therapy and daycare chemotherapy infusion centers. How do you see these advancements shaping the future of cancer care in India particularly?
Look, let me have you in on a secret that Viren made me aware of. If you're interested in a time machine to know the future of healthcare in India, all you have to do is get on a plane, right? Travel east or west, and you'll probably know what the future of healthcare might look like.
Okay.
And 3 or 4 things that I think will happen. I think first we need to diagnose our patients early to improve their chances of recovering and living a healthy life, also reducing the cost of care. So I think there are interesting, low cost, more accurate, more convenient, broad-based screening technologies that are becoming more and more possible that I think will continue to scale in India. I think the second is daycare chemo will become the standard of care for chemotherapy delivery. It
Okay.
honestly makes very, very limited sense, or no sense for most patients to get their chemotherapies in large hospitals. And I think this format, almost like a spa-like, comfortable, patient-centric setting, will become more and more common in India in the decades to come. And the third thing, could be wrong here, but I think we're seeing this massive demand in oncology to continue for the next decade, even more. At the same time, there's very limited supply of specialists. So this format I think will lead to the rise of single specialty oncology businesses like Everhope that will use technology to standardize care delivery, protocols that will use technology to enhance the patient experience. So I think that will continue to happen. We'll see the rise of more single specialty oncology businesses that will continue to leverage to provide.
And one final question, Dr. Pankaj, before I let you go. How do you see Everhope Oncology scaling beyond India in the future? And if you could share with us your long-term vision and any targets.
Look, I think we're in a privileged position to work on an extremely large and hard societal problem. I think our eyes are set on India as a market. There's so much to do to meet the needs of 150 million Indians who are alive today who will get cancer at some point in their life. Long-term vision is very simple: to bring best-in-class, patient-centered, empathetic care closer to the patient's home.
All right. With that, I'll have to wrap up our conversation. Gentlemen, thank you for your time today and for joining us on Startup Street.
Thanks a lot. Thank you. Thanks, Viren.